Hi, I'm Erica. I'm going to be your student nurse today. Today I will be doing a blood draw from the VAD access port. So the first thing I would do is I would wash my hands and put on my gloves. I would ask the patient to state their name and date of birth using two identifiers, the wristband as one, them either responding as another, or I could look at the MAR. I would make sure that they have their mask on. I would then come to the port and I would assess the area around it, looking for any redness or swelling, and I would ask them if they are experiencing any pain. And then I would also assess for allergies. If that was all good, I would then come to my port line and I would make sure that it's unclamped. And then I would take my first alcohol swab and I would alcohol off for 15 seconds. And then I'm going to take my first normal saline flush after this has dried. I'm going to connect it. I'm going to aspirate for blood return. When I note blood return, I'm going to push in the 10 mLs of normal saline using the push-pause method. And then right away, since this normal saline syringe is now empty, I'm just going to aspirate and I'm going to draw 5 milliliters of my blood sample that I'm going to be discarding. And I'll take this off. And then I will set that aside just so I remember that that's my discard syringe with my blood in it. I'm going to alcohol off for 15 seconds. I'm then going to take my 10 milliliter syringe and connect that. And then per policy agency, I'm just going to take a 5 milliliter blood sample. I'm actually going to do 6 just in case. So now that I have that, I'm going to take that off. And I'm just going to set it back in the tip back in the package. I'm going to take an alcohol pad. I'm going to alcohol off for 15 seconds. And then depending on the agency policy, some require you to flush with 20 milliliters of normal saline after. So that is what I will be doing today. So now that is alcoholed off and dried, I'm going to take my first normal saline syringe of 10 mLs. I'm going to push that in using the push-pause method. Disconnect that. I'm going to alcohol off again for 15 seconds. I'm going to take my second 10 milliliter normal saline syringe, so it will be a total of 20 mLs. And I'm going to push that in using the push-pause method. Disconnect that. I'm going to alcohol swab one more time for 15 seconds. And then again, if it's agency policy, I would have to flush with heparin after, but for this case, I'm not going to. And then I would let that dry. I would clamp this. I would then bring my blood sample down to labs. I would take my gloves off, wash my hands, and document.